The Social Services and Wellbeing Act. It's a new piece of legislation nearly 200 pages long, not to mention the additional 9 codes of practice that add over 500 more pages. The Act comes into force on April the 6th and aims to change the way people's needs are assessed and the way services are delivered. It will promote partnership working with health boards and other agencies and give people an equal say in the support they receive. But what will it mean for people with mental illness and their carers? Havel's Public Affairs Manager, Peter Martin, has been involved in the discussions with Welsh Government on the Act.
Well, Haval has been involved in the development of the Social Services and Wellbeing Act since it was first introduced, or since it was first mentioned in early 2013. And then we was involved in a number of technical groups. We had numerous discussions about the potential impact of this legislation on people with mental health problems, and importantly the impact it would have on carers, to ensure that their rights were protected and that there was something in the legislation for them.
Carers should benefit from this Act because it gives them equal rights to people who use social services. Local authorities will now have a duty to provide carers with an assessment of their own needs. Previously, if carers had wanted support, the onus was on them to apply themselves. But what do carers think? This is Joan Kitt. She battled mental illness before her death earlier this year. Her son Frank cared for her alongside help from his sister. He knows the importance of carers receiving support for their own health and well-being.
If they want to be effective carers, then they've got to look after their own health. They're no good to any person as a carer if their own health is going to suffer. So there's it sounds a little bit selfish, but primarily you should avail yourself of all the support that you need to maintain yourself in a good state of physical and mental health.
As for whether this Act will improve services, Frank isn't convinced. He says it's the approach of health and social care professionals that needs to change, not the legislation.
If it is going to change, then it's within the culture, not within the application, because certainly from my experience, the frameworks that are in being now should be effective if they're applied properly. But there's not sufficient resources to really successfully implement it. And I see no reason why that's going to change because of legislation that is coming into force in April.
But others disagree. Jonathan Morgan is a former Assembly member who played a key role in implementing the mental health measure back in 2010. He believes this Act will bring about the necessary change.
The Act is, again, one of those big pieces of legislation that really will drive a significant amount of cultural change in Wales. It is about putting the service user at the heart of everything that's done. The whole notion of collaboration, of co-production, of involving people. So I think it's a really welcome shift. It means local authorities will be doing possibly less. It means they'll focus on those people whose needs are more acute. But I think from a point of view of having a piece of legislation that is transformational, then this sits very well alongside the philosophy of the mental health measure.
Here at the Senedd, the Assembly is in pre-election period, ahead of voters going to the polls on May the 5th. Whether this Act will improve the lives of people with mental illness and their carers, only time will tell. Mike Wood, Havel TV, Cardiff Bay.